Good afternoon, everyone, and I hope I can manage to keep you all awake after your lunch. So, thank you very much. I'm here presenting on behalf of myself and my colleague, Dr. Elizabeth Morrow, and we're with the Faculty of Nursing and Midwifery in the Royal College of Surgeons. And firstly, I would like to just make some acknowledgements, both from our funders for the piece of work I'm going to talk to you about. In addition to that, I'd like to outline our commissioners from the All Ireland Institute for Public Hospice and Palliative Care, also the steering group members and our advisory board as well. So this presentation, what I'm going to talk to you about is the context. Why rehabilitative palliative care, the approach we used within the research, outline just the key findings because I'm very much under time pressure, and just the overview of the position paper recommendations. So the context, why rehabilitative palliative care? It provides the type of care and outcomes that actually people want. It actually reduces deconditioning, particularly among people who have chronic conditions, and it leads to and minimises unplanned admissions. It improves healthcare effectiveness and use of resources, and it supports inclusion. And that is for people with non-chronic or with non-malignant diseases. So we did a scoping review, which is using the JBI approach, which is the Joanna Briggs Institute. We took it for a 10-year period from 2015 to 25, and the return was 157 articles. Following that, we conducted a seminar and workshop, and that was with key stakeholders within the area of rehabilitative palliative care. We did a post-seminar discussion groups, which we held six groups constituting of 18 people. And then that led in bringing together all the information, and we developed and refined the data. And in conjunction with the steering committee, we discussed how to develop further. So this is just an overview of the articles listed by the countries, but also the particular types of studies. And as you can see, they were quite varied, both from a qualitative and quantitative perspective. And interesting, the highest area of rehabilitative palliative care has actually, with the evidence, is in the States. So from those 157 papers, we actually developed a number of themes. And those themes were really around interdisciplinary working and how that would take account of patients and caregivers' experiences, and that really the populations that were most in requirement were complex need patients or those with chronic illnesses, but really that rehabilitative palliative care had to be integrated. And that outcome measures such as quality of life were really, really important to take account of. Potential, also because of the economic perspective, what were the benefits? And the papers also outlined the fact that within that period, COVID-19 had occurred and how that had influenced the delivery of services from a rehabilitative perspective. But also the findings and themes were also taking account of not just physical, but really that spiritual and psychological support that's required. So as I mentioned, the second part was actually the seminar and workshop where we engaged with key stakeholders. And that took place in June. And as you can see from the picture, it was really about asking key questions and asking people for their opinion. Now, these are key stakeholders within that area of rehabilitative palliative care and taking an all-Ireland perspective. And really, the collaborative approach was that it should be interdisciplinary, that there needs to be clear leadership for the actual strategic development of rehabilitative palliative care, that it can take an all-Ireland approach. And it really is about how we would do that from an innovative perspective, covering Northern Ireland and the Republic. And also that really palliative care among the public is seen as palliative care rather than a rehabilitative approach. And that rehabilitative approach is really, really key. And putting that message out to the public is very important. So discussions, I mentioned that there were 6 focus groups. Through that, there was looking at what is the ethos of care. Same thing again, came very strong was the interdisciplinary working, and that it should include all health professionals, and that there should be coordinated solutions, but it should be a person-centered approach that's applied, and there should be a risk confidence and risk communication associated with that. But it is about spreading an innovation across settings and having a positive, and that key message was a positive impact for workforce culture, and that education and training was key. And really, that development of education is very, very important. So through that, we developed what is the rehabilitative palliative care evidence paper to inform. And building on that and engaging with our stakeholders as well as our steering group, we came and we developed a policy focused to turn it into practice, which is that All Ireland position paper on rehabilitative palliative care. So just to expand further, what was really, really important was to try and define what is rehabilitative palliative care. And those key definitions were developed from the concept of engagement with our stakeholders to understand that it is about taking a person-centered approach and interdisciplinary and empowering people with life-limiting illnesses to maintain, improve, or slow the rate of decline of their function and maintain their independence while maintaining also their quality of life. But collaboration, early assessment, tailored interventions to address a person's physical, psychological, and nutritional needs are very, very important. And it really is about what matters to people. And that central person-centered approach is key. And it really, rehabilitative palliative care is about reducing symptoms, preventing deconditioning, and supporting patients in living a meaningful life. And it promotes a shared decision-making process and takes account of the people who are supporting people with chronic and long-term conditions, but their families as well. And taking a holistic approach is key, but that features both for the people with these life-limiting conditions, but very much for the staff, well-being, and that ongoing training, as I mentioned earlier, is key, and that will help to reduce healthcare costs and unplanned hospital admissions. So these key findings, as you can see, are really, as we work around the wheel, are taking a person-centered approach. And it is about that quality of life and supporting people through their illness. And, you know, there is a need to change, and taking that interdisciplinary approach that actually supports both patients and their families, which is very, very key moving forward. So I mentioned that there was recommendations. So those recommendations are around taking on board the definitions that we have been outlined, the model that has been, and if you look at that wheel again, it is that model of what rehabilitative palliative care looks like. From a policy and demographic insights, we need to take account of that. And we need this evidence to inform the development of a rehabilitative palliative care position paper. Moving forward, we currently have a green paper, but the aim is to move towards a white paper to shape and influence policy. Now, I mentioned that we have undertaken doing the scoping review. We've engaged with stakeholders, we engaged with our advisory group, and we developed the position paper, converted that to a green paper, and now what we need to do is move forward and discussions are ongoing as to how that will transfer into a white paper. And then that white paper can be used to take an all-Ireland approach, both north and south, and come together to look at influencing and shaping policy in relation to rehabilitative palliative care. But it is about looking at engaging the next stage to develop a white paper. We will have to come back and engage with key stakeholders again. And it is about having that informed implementation. So it is something that's very new and very different. So it will have to be informed implementation. And it is about what is going to be innovative about introducing rehabilitative palliative care. And then that whole education and training piece is vital as well. So it is now quite a big task for the commissioners now to take on board. But in conjunction with the advisory group, it is hoped that they will come together and take a position where they can collectively take forward the findings from both the position paper, the green paper, and make a decision about taking it further to a white paper or not. So what I finally would like to say is that both these papers are available. They have DOIs, and I know Karen and Jane and Bursara have said that they will share all the slides and all the links, so you can have a read at your leisure in relation to the findings of both these reports. And you never know, in the future we could be talking about a white paper. So thank you very much for your time.